Good day and welcome. Today's presentation on domestic violence and murder suicide in Trinidad and Tobago, a counseling psychology perspective, will be presented by Jessica Laban, Alea St. Louis, Leah Paul, and Angelina Alfonso. Today, we will be discussing a very serious case from Trinidad and Tobago in 2025 involving the tragic deaths of UNC counselor Ramona Victor and her husband Rodney Ramsumer. This case highlights critical issues in mental health, domestic violence, and the importance of counseling psychology assessment methods in preventing similar tragedies. Populations affected and role of counseling psychology. The tragedy affects multiple populations: the victims themselves, their family and community, colleagues, first responders, and the wider national population who are repeatedly exposed to domestic violence incidents in the media. Counseling psychologists play a vital role in addressing these risks. They specialize in emotional regulation, conflict resolution, trauma intervention, and crisis management. They can help individuals and couples manage emotional difficulties, recognize warning signs, and access emergency or therapeutic support, potentially preventing tragedies like this. Assessment Methods Overview. To understand and intervene in cases like this, counseling psychologists use several assessment methods. These methods aim to detect early warning signs, assess risk, and guide interventions that can prevent harm. Let's go through each method in detail. Clinical interviews. Clinical interviews allow psychologists to explore current stressors, emotional challenges, relationship conflicts, and history of trauma or violence. Involving family, friends, or colleagues helps identify behavior changes or escalating conflict. In this case, the husband left a distress note, which interviews might have helped to interpret, potentially relieving emotional instability or relationship strain before the tragic event. Mental health screenings. Standardized screenings are used to detect depression, anxiety, suicidal or homicidal thoughts, and indicators of intimate partner violence or poor impulse control. Tools include the PHQ-9 for depression, GAD-7 for anxiety, suicide risk protocols, and the danger assessment for domestic violence. These tools help identify risk early, which is crucial because murder suicides often develop from emotional deterioration over time. Couples or relationship assessment. Since many murder suicides arise from relationship instability, assessing communication patterns, conflict triggers, power imbalances, attachment styles, jealousy, and emotional disconnect is essential. Identifying unhealthy dynamics early allows psychologists to intervene before escalation occurs. Behavioral observations. During sessions, psychologists monitor for aggression, hostility, withdrawal, fear, poor emotional regulation, passive aggressive behavior, signs of intimidation, and high emotional reactivity. These behavioral cues help evaluate whether a relationship is potentially dangerous. Intake forms and background information. Intake forms provide important context such as family background and history violence, substance abuse, financial stressors, work related pressures, social support levels, history of mental illness, and prior relationship conflicts or separation. Risk assessment. Risk assessment is a critical step. Psychologists evaluate threats to both partners, including prior violent incidents, jealousy, escalation, or stalking, and risks to self, such as suicidal ideation or sudden mood changes. Tools like danger assessment and suicide risk protocols guide whether immediate intervention is needed. In this case, risk assessment might have identified red flags and potentially saved lives. Record review, document analysis. Reviewing records such as police reports, medical history, workplace reports, social media activity, and written communication can reveal patterns of distress or escalation. The distress note left by the husband could have been analyzed to identify psychological deterioration. Now we link the assessment to the case. So, in this case, the distress note indicated emotional overload and hopelessness. Couples' assessments could have detected relationship conflict, and risk assessment tools might have revealed lethal potential. Collateral interviews would have provided additional context on behavioral changes. Overall, these assessment methods are designed to detect danger early and guide interventions that can prevent tragedies like murder suicides.
The technique used in trauma counseling can vary depending on the type of trauma, but some examples are imaginal exposure. The trauma is imagined and described aloud to the psychologist so that the individual can confirm the traumatic memories. Written account, writing a descriptive of the trauma experience for the psychologist. An impact statement, writing an impact statement explaining why you believe the event occurred and the impact it has on your life. Trauma counseling would greatly benefit the couple's 17-year-old son who was left behind. The incident in itself could have given the son trauma, either from learning how both his parents passed away or that his father murdered his mother. The son not only has to mourn his parents, but also will deal with the scrutiny placed on him from the media and the public, as well as process how he feels about the incident. Cognitive processing therapy would allow him to challenge his perception of why the incident occurred and help him understand his thoughts and beliefs about the experience. The trauma counseling gives him a way to express himself and free himself from the shackles of his past haunting him. Stress management is the range of techniques, strategies, and therapies designed to help people control their stress, done by lowering acute or chronic stress to their health and overall well being. Stress is the body's response to the changes that occur in your life. Since life is ever changing, individuals just need to manage the unnecessary stress that's caused by stressors. A stress is any type of stress you have experienced, no matter the source, as what constitutes as a stressful situation differs. Some strategies to lower your stress can include meditation, mindfulness, positive thinking, eating a healthy diet, and psychotherapy. The way that stress is perceived by an individual can differ, as some may feel headaches or stomach pain while others experience life threatening symptoms that can be detrimental to their health. This is where stress relievers enter as a quick fix to make you feel calmer. For example, breathing exercise, and then there is stress management therapy. Stress management therapy is the same as stress management, except it is used to prevent stress or cope with scenarios that can lead to increased levels of stress. Stress management therapy is beneficial as it reduces the negative effects of stress like physical and emotional challenges. For example, increased anger and trouble sleeping that compromises the quality of life. The impact of using stress therapy is that it prevents the negative effects and increase your quality of life. Things like better digestion, improved immune system function, and lower blood pressure. Some types of stress therapy include cognitive behavioral therapy, talk therapy that focuses on the connection between thoughts, emotions, and behaviors and how changes made to one can change changes in the other as well. Mindfulness based stress reduction, the combination of mindfulness techniques and stress management techniques to prevent and address stress. And then psychodynamic therapy, which is talk therapy that increases an individual's self awareness to how past stressors influence stress and how they cope with it. The stress the couple would have endured for a period of time probably accumulated and came out on the day of their death. Stress management could have saved the couple's life if they were to practice it, as it would have made them clear headed. Because stress affects everyone differently, the couple may have lashed out or reacted in the moment and ended up having regrets later. Victor's common law husband may have experienced high levels of stress, and she was the victim of the release of such stress and lost her life. In his guilt, he took his own life as well. Stressors can be anything or even a person. That's why the counseling psychologist would have aided him in identifying the behaviors and patterns that cause him to feel like that, or even help him to develop strategies to alleviate his stress. Support groups are where people with common issues gather together to share what has been troubling them. The shared experience often comforts them, gives them encouragement. Support groups provide a safe place for its members who have experienced a traumatic event to share their experience and express themselves with those who know what they have been through. It can be hard sometimes when there is no one around who can offer support. Support groups help their members to cope as they are all dealing with the same specific issue, which can range from alcohol sobriety, cancer, or even domestic violence. It shows an individual that they are not alone and that others share their struggles as well. It makes seeking help not appear as intimidating. There are different types of support groups individuals can attend depending on their needs. Some groups are mutual support groups, peer led, where the facilitator receives the necessary training but doesn't give advice or act as a professional. These groups are usually a way for its members to share what works for them or to inspire others. Therapy groups, led by a mental health professional that brings individuals with similar conditions together, and online support groups, an alternate to in person support groups that are convenient and useful to individuals who live far away or those who do not wish to interact with others. The support group would help to resolve the incident in the article in two ways. The first way is for the couple to attend support group meetings with other couples that are going through something similar, where they have an opportunity to improve their relationship. The support group allows them to get things off their chest and to share their experience as well as learn from other couples there, ranging from what worked for them or what they can avoid. The second way would be for those left behind and dealing with the aftermath of their deaths. For example, their parents and son, they would enter a mutual support group so that they can receive support from a community who knows what they went through and validate what they feel at the moment. Motivational interviewing is a client centered counseling approach that is designed to help individuals find motivation to make a positive behavior change. Motivational interviewing was developed by William Miller and Stephen Rowling to treat alcohol addiction as a way to empower people to take responsibility for their own recovery. It should always be implemented with a particular spirit. According to Miller and Rowling, the spirit is a collaborative, evocative, and honors client autonomy. The spirit must be maintained for the therapy to work. Collaboration instead of confrontation is a partnership formed between the counselor and the client for motivational interviewing. This relationship is based on the point of view and experience of the client. Evocation rather than education comes from the notion of the counselor throwing out the client's ideas rather than imposing their own opinions on the belief that motivation to change comes from within. Autonomy over authority is a recognition that the true power for making decisions is with the client, not the counselor. Motivational interviewing has four principles that aid in the recovery process, as it is vital to establish trust within the therapeutic relationship. 1. Express empathy, where the psychologist focuses on understanding the situation from the client's perspective. 2. Develop discrepancy, the belief that a person becomes more motivated to change once they see the mismatch between where they want to be and where they are. 3. Role of resistance, helping the client to gain a new understandanding of themselves and their behavior by using methods like reframing or offering different interpretations of a situation. And 4, support self efficacy, where the counselor supports individual self efficacy by reinforcing their power to make changes they want.
Good day, today I'll be discussing theoretical approaches and barriers. Firstly, I would like to introduce the counseling theories applied to the UNC counselor murder suicide case. We use four main approaches: cognitive behavioral therapy, trauma theory with grief counseling, motivational interviewing, and family systems theory. These frameworks help explain the thoughts, emotions, and family dynamics of survivors, witnesses, and relatives. They guide interventions that promote safety, coping, and emotional recovery in a culturally sensitive way. Cognitive theory. Cognitive behavioral therapy focuses on the connection between thoughts, emotions, and behaviors. Survivors and family members may experience self-blame, hypervigilance, or thinking the worst will happen after violent events. CBT helps clients identify and challenge these distorted thoughts, manage anxiety, and develop coping strategies. It is particularly useful for families in shock, giving them structured ways to process trauma and regain control. Trauma theory and grief counseling. Trauma theory shows that violent events can overwhelm normal coping. In this case, discovering the bodies or learning about the murder-suicide likely caused shock, fear, and confusion. Trauma-informed grief counseling prioritizes safety and emotional regulation, helping survivors process their loss gradually. Techniques such as grounding exercises, narrative work, and guided processing help families work through intense emotions while avoiding re-traumatization. Motivational interviewing. Motivational interviewing is a client-centered approach that helps people explore ambivalence and find motivation to seek help. In domestic violence cases, fear, stigma, or shame may prevent engagement. Motivational interviewing builds trust, reduces resistance, and supports self-confidence. It is useful for survivors, family members, and even high-conflict partners who are hesitant to participate in therapy, helping them to see the value of counseling without feeling pressured. Family systems theory. Family systems theory views problems as part of larger relational patterns. Domestic violence affects rules, communication, and boundaries. In this case, secrecy, conflict minimization, and family patterns may have contributed to escalation. Family therapy can uncover unhealthy patterns, improve communication, and support mutual coping. Interventions focus on relational dynamics, helping the family navigate grief and trauma safely. Why these approaches fit the incident? These four approaches complement each other. Trauma theory addresses the emotional impact of violent death. CBT helps stabilize thoughts and behaviors. Motivational interviewing engages those hesitant to seek help. Family systems theory addresses relational dynamics. Together, they provide a comprehensive, culturally sensitive response that supports trauma recovery, family functioning, and overall well-being. Barriers to resolution. Domestic violence cases often face obstacles that affect therapy engagement. Barriers include stigma, cultural norms, fear, financial constraints, and emotional overwhelm. Understanding these challenges is critical for planning interventions that are realistic, culturally sensitive, and effective in helping families cope with trauma and grief. Some key barriers in this case. Key barriers here include mental health stigma, fear of judgment, family secrecy, and cultural norms that minimize conflict. Limited access to specialized trauma services and emotional shock also reduce motivation to seek help. Recognizing these barriers is essential to design interventions that overcome resistance and support engagement. Additional barriers affecting recovery. These are barriers that appear after the initial shock but still strongly affect recovery. Families often struggle with practical issues like police follow-ups, managing funeral arrangements, or dealing with the media, all of which add stress. Emotional overwhelm can also lead to delayed grieving, where people shut down instead of coping. Caregivers may become exhausted or burnt out while trying to hold the family together because communication often breaks down after a traumatic death. Families may pull away from each other instead of seeking support. These barriers are different from stigma and secrecy. They are post incident complications that make recovery harder. To summarize, CBT trauma theory with grief counseling, motivational interviewing, and family systems theory provide evidence-based guidance for counseling in domestic violence and murder-suicide cases. These approaches help stabilize trauma symptoms, support grief, repair cognitive distortions, and improve family dynamics. At the same time, barriers like stigma, access, and family dynamics must be considered. Combining theoretical knowledge with awareness of real-world obstacles ensure interventions are safe, effective, and culturally sensitive.
Good day. Today I will be discussing the ethical issues with counseling in psychology. Firstly, obtaining informed consent. Informed consent ensures clients understand and voluntarily agree to therapy's nature, risks, benefits, and limits, supporting their autonomy through ongoing dialogue and documentation. This ethical cornerstone requires counselors to provide clear, comprehensive information about the therapeutic process, including goals, potential outcomes, confidentiality boundaries, and alternatives. It's documented via forms and revisits as therapy evolves. Risks include client misunderstanding leading to ineffective treatment or legal disputes. Evidence from autonomy research shows it boosts engagement. Strategies involve using plain language, involving guardians for vulnerable clients, and periodic check-ins to maintain ethical integrity. Confidentiality and privacy. Confidentiality protects client disclosures to build trust, but includes legal exceptions for harm risk or mandatory reporting, requiring counselors to balance privacy with safety. Counselors must safeguard all client information unless exceptions apply, such as imminent danger, like suicidal threats, or legal mandates, such as child abuse. Privacy extends to records and communications. Breaches can erode trust and cause harm. Studies link strong confidentiality to better therapy outcomes. Counselors explain limits upfront, use secure methods, and consult supervisors for dilemmas to uphold ethical and legal standards. Dual relationships. Dual relationships involved additional personal, financial, or social ties beyond therapy, which can impair objectivity and risk exploitation, so they should be avoided. These occur when counselors share roles like friendships or business dealings with clients, blurring professional lines and potentially harming the therapeutic process. Ethical codes prohibit most to prevent conflict. Research shows that they correlate with violations. Counselors assess risks, document avoidable ones with consent, and seek supervision to maintain boundaries and protect client welfare. Boundary issues. Boundaries set clear professional limits to prevent inappropriate involvement, ensuring the therapy focuses on clients' needs and avoids exploitation. This involves avoiding actions like excessive self-disclosure, physical contact, or gifts that could lead to dependency or bias. Crossing boundaries risks emotional harm and ethical breaches. Guidelines emphasize early rule setting. Evidence indicates strong boundaries enhance therapy effectiveness. Counselors monitor interactions, address slips promptly, and consult peers to sustain a safe environment. Competence of the counselor. Competence demands counselors to provide services within their training and experience, with ongoing education to avoid harm from practicing beyond expertise. Counselors must recognize limitations and refer clients when needed, ensuring skills match client issues. Incompetence can lead to misdiagnosis or poor outcomes. Ethical standards require professional development. Research shows competent practitioners yield better results. Strategies include certification, supervision, and self-assessment to stay updated and ethical. Cultural sensitivity. Cultural sensitivity requires respecting diverse backgrounds to provide inclusive, bias-free care and adapt therapeutic approaches accordingly. Counselors must understand clients' cultural values, avoid stereotypes, and promote self-awareness for effective treatment. Insensitivity worsens disparities and violates justice. Studies link it to improved outcomes for diverse groups. Training, culturally adapted tools, and reflection through supervision help foster affirming environments. Online counseling challenges. Online counseling offers convenience, but it poses ethical issues like privacy risks and technology limitations, requiring secure practices and suitability assessments. Digital platforms introduce challenges such as data breaches and reduced non-verbal cues, necessitating Health Insurance Portability and Accountability Act, or HIPAA, complaint tools, and specific consent. Inappropriate for crises, research supports its effectiveness with safeguards. Counselors verify identities, test technology, and have emergency backups to address accessibility while protecting client rights. Record keeping. Accurate, secure record keeping maintains care continuity and compliance, protecting confidential information from unauthorized access. Records include session notes and assessments, retained securely and disposed of properly. Poor practices risk breaches or errors. Ethical codes outline standards. Studies emphasize their role in quality care. Counselors use encryption, follow retention laws, and train on security to balance clinical needs with privacy. Termination of counseling. Termination involves ethically ending therapy with client discussion, referrals if needed, and support for closure to promote independence. Counselors assess readiness, avoid abandonment, and align termination with goals. Premature ends can cause distress. Research shows proper handling aids in long-term growth. Strategies include open dialogue, progress summaries, and follow-ups to ensure ethical transition. Lastly, handling emergencies. Counselors must prepare for crises like suicide risks by assessing dangers, intervening appropriately, and balancing protection with client autonomy. This includes risk evaluation, emergency services involvement, and involuntary measures if needed. Mishandling risks, harm, or liability. Guidelines stress timely action. Studies highlight intervention's importance. Counselors develop plans, train in assessment, and consult resources to navigate complex situations in an ethical manner.
This takes us to our conclusion. To summarize, Murder-suicides are rare but highly impactful events rooted in emotional, psychological, and relational distress. Counseling psychologists play a vital role in assessment, early detection, intervention, and crisis management. By using clinical interviews, mental health screenings, risk assessments, and collateral consultations, psychologists can identify warning signs, support victims and families, and potentially prevent such tragedies. Thank you for your attention. This is the end.
That brings us to the end of our presentation. Thank you very much.